Hello, I am Eli Adashi, Professor of Medical Science at Brown University and host of Medscape One-on-One. Joining me today is Karen Bass, a physician assistant by background who is presently serving as the representative of the 33rd District of the State of California. Welcome.
Thank you. Thanks for having me on.
We are really privileged to have somebody such as yourself who is a provider legislator. I thought we would start with an issue that clearly troubles all of us, and that is the relative shortage of primary care providers, and the notion that perhaps we could address this issue by introducing and promoting and enhancing the contribution of other healthcare providers beyond physicians. I was wondering if you could share with us your thoughts about it, given your unique background, and given that we really have a challenge in our hands.
Sure, absolutely. We have a challenge and we have an incredible opportunity. I remember a couple of years ago when healthcare reform was being debated and everybody was talking about expanding coverage to 30 million people who are uninsured. And frankly, the first thing that came to my mind is, who's going to provide the care? I mean, it's been many years since I was in clinical medicine, but when I was in clinical medicine, we had an incredible shortage then. I remember nurses being recruited from the Philippines and from Canada. I remember having to serve double shifts and fill in 5-6 extra days a month because we had a shortage. And now we're talking about expanding coverage. So I think our challenge is, how do we do it with the current workforce? The opportunity is, it's a jobs program. We need to hire, we need to train, we need to recruit. And then to me, one of the things that's most important that we need to do to expand the workforce is to figure out how young people and career changers who might be a little older are going to be able to afford the extra training that's needed so that they can participate in the healthcare field.
Can we point to segments of the Affordable Care Act wherein the very concept of using a multitude of healthcare providers is in fact embraced, but further, segments wherein perhaps funds or call for funds for further training is in fact emphasized?
Sure, I think there's a couple of places. First of all, the Affordable Care Act's focus on prevention lends itself to expanding the healthcare workforce. Of course, I want to promote mid-level practitioners, physician assistants, nurse practitioners, who can play that role in expanding primary care. Because when you're talking about prevention, you are primarily talking about primary care, people who practice in that field. So the Affordable Care Act's emphasis on prevention, I think, is one place. And then two other places. One part of the Affordable Care Act called for forming a work group that is actually going to look at the workforce. Unfortunately, because of the partisanship and the commitment of some to repeal the Affordable Care Act, that part of the act has not been appropriately funded. So we do need to have that work group that looks at the long term in terms of how we expand the workforce. The other place that I would point to is the part of the act that called for the centers of innovation. And so I've been talking with many practitioners in my community, for example, who have submitted proposals to have innovative ways of providing health care in areas where there's a great need. So those three places are places where you can look at expanding the workforce, including other practitioners, and focusing on prevention, which, again, all roads lead back to primary care.
I believe at least a modest amount of support has been assigned through the Affordable Care Act to nurse-run/staffed clinics. It is probably more of a demonstration project given the amount of funds that have been allocated. But in broad strokes, what is your outlook on that type of initiative or a physician assistant supported/staffed clinic that would focus, of course, on primary care.
Well, I think we're a little stalled right now. To the extent that the Affordable Care Act is moving forward, it's the part that was already funded and already passed prior to this particular Congress. So in terms of any additional programs or additional funding, I believe we're in a holding pattern right now. Now, of course, I'm optimistic that that holding pattern won't last beyond this year, but I do believe that's where we are right at this moment.
We've been given to understand that there is a nursing bill in the works that, among other things, seeks representation of the nursing profession in the office of the Surgeon General.
Mm-hmm.
Where do you stand on that issue? How do you feel about that as a need to complement what has traditionally been really a physician-dominated office?
Well, I always support expanding, because to me, when I think of expanding, I think of providing care in areas that are underrepresented and underserved. And so I think that's a fine idea, and I hope it expands beyond nurses as well.
I can't help but reflect on the deliberations in the Supreme Court about a week ago now. You must have watched this with equal interest. Would you care, for the benefit of our viewers, to just maybe share a few of your most prominent thoughts on what transpired and perhaps what's ahead?
Well, I think a few things. One, I am not a lawyer, so I have to say that. And what I have heard from people who are lawyers and have experience in arguing cases before the Supreme Court is that you can't judge what the outcome of the court decision might be based on the arguments. And if you think about it, you know, this was the first time we actually heard arguments. It might have been a lot better if we saw it, because and I feel so bad for the individual that was arguing on behalf of the administration, where he choked and picked up a glass of water. If we were watching that, it really wouldn't have been a big deal. But hearing it, it sounded as though he really made some big stumble. And so I have to be optimistic and believe that you can't just judge what the outcome will be based on how the arguments went. So I think we really don't know. It'll be until June when it happens. And then if it happens in a way where the individual mandate is struck down, I don't believe the overall bill, however, will be thrown out.
With your permission, let me turn now to Medicare and perhaps to other safety nets.
Sure.
As we look at the current scene, it would appear that two opposing worldviews are in conflict. On the one hand, we have the Affordable Care Act vision for Medicare and the administration. On the other hand, we have the proposals by Congressman Ryan and a very different worldview on the same. Having this unique vantage point that you do, what can you tell our viewers on the fundamental differences between two approaches and where potentially all this might lead this year or potentially beyond?
Well, actually, you are polite in describing it as two different worldviews, because that can't be emphasized enough. And I think that it's important that people read Congressman Ryan's documents, The Path to Prosperity, because essentially the two worldviews are like this. I happen to believe that in our country, which is the richest nation on the planet in the history of the world, that we should be able to figure out how to provide for those who are least able. So when I look at children, when I look at seniors, the disabled, etc. Essentially what Paul Ryan is calling for is taking the guarantee that we have lived with in our country for decades, that when you turn 65 or if you are disabled, that we will provide health care for you. He believes in taking this and turning it into a voucher that I would hand somebody when they become 65. And I would say, here's your $1,000 check. Let me shake your hand. Now go find health insurance. The problem is that that same worldview believes in repealing the Affordable Care Act. If you repeal the Affordable Care Act and you cannot guarantee that if you have a pre-existing condition that you will be covered, what is your $1,000 check going to buy you? And then if you have a major problem after you've spent your $1,000 check, then what? And so I believe that our country has the type of wealth that we can continue the guarantee to people who are seniors and to people who are disabled. Medicaid, he wants to take Medicaid and give the $1,000 check to a state. So if a state like...
the so-called block grant.
Yes, using California, for example, if California was given a fixed amount of money that said, this is how much you have to provide for health care for the poor and for people in nursing homes, because Medicaid doesn't just pay for the poor, it pays for nursing homes. Well, what about when California went through the recession and tens of thousands of people were laid off their job? Well, what's the first thing that happens when you're laid off your job? You lose your health care. So if you give a state a fixed amount of money to provide health care, then if there is an emergency or a change in the economy, that state literally runs out of money. And so it's two worldviews that says survival of the fittest. The other worldview says the richest country on the planet in the history of the world should be able to prioritize health care and other resources for people who might fall through the cracks.
Yes. As you can imagine, especially our physician providers continue to be concerned about future reimbursement under Medicare as dictated by the sustained growth formula.
Right.
We've gone through many years during which we have postponed, if you will, or avoided a final or permanent fix. Everybody is curious as to what would happen next, and if so, when.
Well, first of all, I believe that the reimbursement rates need to be higher, significantly higher, and I also believe that they should be permanent. I don't think that this should reach a crisis point almost on an annual basis where we're getting close and we have to do what we call here the doc fix. Let's make sure it doesn't run out. First of all, I am convinced that it will not run out, that we will continue in this crisis mode for a while until things change in the Capitol. But I think if you fundamentally change Medicaid and Medicare, then we are going to be in a perpetual state of crisis. So there needs to be a permanent fix. Reimbursement rates need to be significantly higher.
Subject to the usual limitations in foretelling the future, what would be your best prediction as to health care under President Romney were he to be elected?
Well, if President Romney is elected, it also is contingent on whether or not the Republicans would be in control of the Senate and the House. So let's just say that happens. If all three happen, then I think health care reform would be repealed. I think Medicaid would be block granted. And I think that Medicare would be turned into a voucher system. I think that our country, and I say this in all sincerity, because I have read The Path to Prosperity, and I encourage people to read Paul Ryan's document. If that were enacted, it would fundamentally change our country, and it would change our country in what I believe is a cynical fashion that essentially would leave lots of people falling through the cracks. And why in the 21st century we would be turning the clock back is beyond me.
In a word, if that were all to transpire, it's far more than just a fiscal change in our policies and in the safety nets. It's really a change in world outlook.
It is a fundamental change in our country, and I think that it's a cynical one.
If I may close on a personal note, many of us admire the fact that a provider such as yourself has taken on public service. Could you perhaps trace for us briefly the kind of seminar events that ultimately encouraged you or directed you towards public service?
Sure. Well, I actually was always involved in public policy and politics from a child. It happened to be the time period that I grew up, the 60s and the 70s, when lots of people were involved. But I will just tell you, from the point of view of a provider, I worked several years in Los Angeles County's trauma unit in the emergency room. And I would see people come in the emergency room day in and day out. And I was just fixated on what drove them there in the first place. I liked the instant gratification of being able to fix someone and send them on their way, different than dealing with a chronic disease. But on the other hand, I was very driven by why they were in the emergency room to begin with. And everything we've been talking about these last few minutes is an example of that. They were in our emergency room because they didn't have health care. They were in our emergency room because they had substance abuse problems and they didn't have treatment. And so the social and health issues that drove them to the emergency room is what drove me into a career in public policy.
Thank you.
Thank you.
On this note, sincere thanks to Representative Bass and to you, our viewers, for joining Medscape One-on-One. Until next time, I am Eli Adashi.